So the first thing to say is that erectile difficulties are common at all ages. And there was a recent survey looking at this, 18 to 74-year-olds. And the overall rate of erectile difficulties is about 13%. And then if you look at the younger age group, 16 to 24, it's about 8%. And you look at the slightly older age group, 50 to 74, it's about 30%. There's also another study recently looking at the over 75s, and they found the rates of erectile difficulties of about 70%, so quite a lot higher as you get older. Most people have heard about Viagra and other drugs. Indeed, Viagra's been around in the UK since 1999. And I think the fact that there are some effective treatments for erectile difficulties has led more people to come forward and seek help for these kind of problems. But some studies still show that only about a third of men with erectile problems actually come forward and seek any help for their difficulties. So it's really good that you've asked this question. And I think now what we need to do is look at the causes of erectile difficulties. So for a man to get a good hard erection, he needs to have the right hormones, the arteries working, the veins, the nerves. There's a very close connection between the brain and the genitals, which we'll explore later. And these all need to be working. If there's a problem with any of these mechanisms, then people can run into difficulties. So when I see people in my clinic, I really take a detailed history. I want to know exactly what the problem is, want to know their past medical history and other difficulties they're having. So for example, if I saw a man who's having difficulties getting a hard erection with his partner, but actually he's absolutely fine when he's on his own masturbating, he gets good hard erections in the morning, then it may be that his problem is what we might call more psychological. The sort of plumbing is working, but it's about the connection between here, and we'll come on to that again later. But the studies have shown that actually about 70% of men who have erectile difficulties, they're actually more likely to have a physical or more organic cause underlying that erectile difficulty. And that's why it's so important to go and see a doctor. And indeed in my clinic, we often see people and we diagnose them with an underlying medical condition. So high blood pressure, commonly diabetes, high cholesterol, low testosterone, sometimes more neurological type problems. And we actually diagnose them in the clinic before they know they even have those problems. They've presented with erectile difficulties. Sometimes people present with erectile difficulties and actually have underlying prostate problems. So it's really important that you go along and get checked out. Now, thinking about one of the most common causes of erectile difficulties is arterial disease. And this is really a bit about plumbing. So if you think about the arteries that supply the penis, they're about 1 to 2 millimetres diameter. If you think about the arteries that supply the heart, they're about 3 to 4 millimetres diameter. And those to your brain are a bit bigger. So what can happen is you can get narrowing of the arteries to your penis before any other arteries. So there's a cardiologist, Graham Jackson, who's done some really excellent work looking at this link. And what he's shown is that quite often you can have people who've had heart attacks develop their erectile difficulties about 3 to 5 years before they have their heart attack. And the good news here is that if you intervene here when you've got the erectile problems, you can actually do something about reducing your risk of then developing that heart attack. Now, all the things that are good for your heart are good for your penis, and you all know what they are. But for example, healthy diet, exercising, not smoking, making sure your blood pressure's fine, making sure your cholesterol's fine. If you're overweight, reducing your body mass index. All those things that are good for your heart are good for your penis. What we do also find is that some medical conditions put you at a really high risk of having erectile difficulties. So for example, about half the men with diabetes have erectile difficulties. And lots of men with conditions like multiple sclerosis, for example, very common to have erectile difficulties. So if you have any of these chronic medical conditions, then do go and talk to your specialist or talk to your GP about your sex life. We do see some men where their erectile problems are more psychological in cause. A bit like the case I mentioned earlier, what we call situational erectile difficulties. It's fine in some circumstances, but not in others. And some men can develop what we might call performance anxiety. Now this may start from one drunken night when erection didn't work, which is not surprising. And then the next time they have sex, they worry about the problem and then it continues. And it's a bit like a ball going down a hill, and they continue with the problem long after the initial problem has gone. The other thing is that lots of men who have more organic, more medical causes of erectile problems also develop some psychological problems. If it's not working, you're going to worry it's not going to work, and on the problem goes, and this can make it worse. Now, in terms of understanding this close link between your brain and your genitals, just imagine you're a man, you're standing in the middle of the road with an erection and a car is coming towards you. I don't know why you'd be doing that, but just imagine that you were doing that. Now, what you would do is you would jump onto the pavement straight away and you'd lose your erection. And you wouldn't consciously be aware of either of those things. But that really shows you how strong the connection between here and here is. And this is what's often happening when people have what we call psychogenic ED, psychogenic erectile difficulties. So there are a lot of other causes that might be important here too. So for example, relationship problems, sexual difficulties in a partner, other life events, unemployment, bereavement. There can be problems with side effects from other medications. So for example, some people develop erectile difficulties from a tablet they may take for blood pressure or for depression or for hair loss. Your mental health is important here. Depression, anxiety can all really impact on you and how you feel sexually, your desire, your arousal. Any kind of pain or chronic pain might be really important here. On a practical level, so getting into a position where it works for you if you've got chronic back pain, but also other chronic health conditions can affect your desire and your arousal. I've gone through a long list here. It is not exhaustive. There's lots of different causes that can add or be the primary cause of sexual difficulties. But hopefully what I have done is shown you that there are many causes, important causes, of why you might be having problems with your erection. And hopefully you will understand that you as the patient needs to think why. Why have I got problems with my erections? And go and see a healthcare professional, either your GP or get seen in a sexual health clinic. And hopefully it will prompt your healthcare professional to ask why and look for the cause, as well as thinking about treatment. What we would do is a number of baseline investigations. So we measure things like your blood pressure, cholesterol, your testosterone, and other investigations as needed. Now on to the bit that people are more interested in, and that's treatment. Think about the medical treatments first. So there are lots of medical treatments to help men with their erections. You've probably all heard of the tablets that we give. They're called PDE5 inhibitors, phosphodiesterase inhibitors. So things like sildenafil, tadalafil, or the trade names of Viagra, Cialis. They don't actually give you an erection, but if you've got the desire and the arousal, they will assist you to get that erection and to maintain that erection. Now you can get some side effects from these tablets. They're usually mild. The most common ones are a bit of facial flushing, headache, blocked nose, indigestion. Often the more times you take the tablets, the less the side effects. And obviously if you get any side effects you're concerned about, do go and see the doctor that prescribed them to you. One thing that's really important here is that you mustn't take these tablets with nitrates. Now nitrates are tablets that you take for heart pain, or you take in a spray if you have angina. They're also what makes up poppers, a recreational drug that some people sniff. The combination of nitrates and our tablets mean that your blood pressure can dangerously drop. So that's an absolute no-no. Also, if you're taking those medications, you must speak to a doctor, and if you're being prescribed anything else, they must know that you're taking this drug. So if those tablets don't work at maximum dose, sometimes we can combine those tablets, or we can try different treatments. And that includes local treatments to the penis. So they're the medical treatments that I've just outlined. There are other treatments, and often we use them in a combined approach. So sometimes people need relationship counselling or a more sex therapy based approach. The other thing we use a lot in our clinics is mindfulness meditation. And this is really important because most of us will benefit from this in all aspects of our life, actually, not just during sex. Our thoughts are a bit like a fly going around in a jam jar. You're constantly thinking of other things and trying to multitask. And actually with mindfulness, the point is we're just trying to get people to focus and give attention to what's happening in the moment. This is really important during sex because often if you've got a problem, your mind's focusing on your performance, you're going to get an erection, lots of spectatoring. and lots of thinking about goals and whether you're going to achieve them. Whereas mindfulness allows you just to give your attention to the present moment, and it takes that pressure off about maintaining your erection or worrying about whether it's going to stay there or not. Maybe we'll do a bit more of this on another video. So I know that's a lot to take in, but in summary, erectile difficulties are common, but please don't expect to have them just because you're aging. But if you do have difficulties, please go to your GP or a sexual health clinic and get some help for your problems. There are lots of effective treatments out there. So I hope that answered your question, and I hope you found that helpful. Please do watch the other videos, and if you have any other questions, please send them in via the comments section below. And thank you for watching.
I believe in miracles. Where you from? You sexy thing, you. I believe in miracles. Since you came along, you sexy thing.